Well, one of the first cases of COVID-19 in La Crosse County was a Mayo Clinic health system employee, and the virus spread to members of her family. They have all since recovered, and now they're giving back to help others who may be struggling with the virus down the road. A friendly,
They're mostly friendly games.
yet competitive game of cards
We got the queen.
is how Carrie Hauser and her family from Onalaska like to help pass the time at home these days.
We were really lucky.
Not necessarily in the game, but in the hand she and her family were dealt with COVID-19.
Never in a million years would have guessed it.
Carrie first noticed something was a little off while doing yard work on a Saturday in early to mid-March.
I didn't feel bad. I just didn't feel quite right. And, I had a little bit of achiness, and I thought, oh, shoot, it's from bending over in the flower beds or, from raking. I just overdid it.
Although Carrie doesn't work directly with patients in her position as an operations manager at Mayo Clinic Health System La Crosse, she wanted to make sure the symptoms she was experiencing weren't something to be concerned about.
Working in a healthcare setting, the last thing you want to do is be the person that spreads it to other people.
Because she's considered a healthcare worker, Carrie met the requirements at the time to get tested.
I got the phone call from an infectious disease doctor in Rochester that I was positive, and I was shocked. So super surprising.
Carrie's husband, who was also having symptoms at the same time, was never tested but presumed to be positive.
I think the symptom that was most prevalent to us was just being unusually tired. Just a little lethargic, very, very mild. We never required any medical care. I think we expected it to be different than it was. We expected it to be something that you go, oh yeah, this is it.
Their 20-year-old daughter, Claire, a University of Minnesota student, and her boyfriend were home and developed symptoms as well.
Came here to social distance and self-isolate and all of that. And then got the virus in my own house.
Claire tested positive while her boyfriend did not. Her younger brother, 17-year-old Carter, never developed any symptoms.
When they released us from our isolation, we were basically told we were all presumed positive. And Carter would have been asymptomatic, but likely positive.
Public health officials told Carrie they believe she and her husband picked up the virus the weekend prior to showing symptoms at a hockey tournament in Milwaukee, an area that is considered a hot spot in the state.
So you just start going, well, did I touch a door handle? Did I, was it the soda dispenser? Was it the, you really start to second guess yourself.
Even though they're well past their isolation period and are presumed immune from the virus at this point, they're all still following guidelines themselves and are hoping others do too.
Take every precaution. We thought that's what we were doing, but it was obviously too late. So I think my biggest piece of advice would be to just assume that every time you leave the house you're being exposed.
And while this experience hasn't been easy on any of them, it's also allowed them time to reflect on just how lucky they are.
You go through really difficult things like this, I think you feel compelled to figure out how you can be a part of helping.
One way they're doing that is by signing up to donate plasma, as Mayo Clinic in Rochester is leading efforts to collect plasma from patients who've recovered from the virus, which in turn can help others who find themselves in a more serious condition.
There's antibodies in the blood of those who have been infected, and those antibodies can help those who are either critical because of the illness or at high risk due to the illness.
We're now at no risk ourselves and at no risk of spreading the virus to anyone else. So I think we're in a really unique position of being able to do things that other people aren't able to do.
Who's got the two?
In the game of cards, you're dealt the hand you're dealt.
300.
Just like in life, it's what you do with that hand that makes the difference.
When really bad things happen, humanity really shows some really remarkable humanness.
While Carrie and her family experienced only minor to moderate symptoms, everyone reacts differently to the virus. Obviously, we've seen hospitalizations and even deaths. So she says it just goes to show that you could be infected and spreading the virus without even knowing it, which is why it's so important to take those precautions and follow the guidelines.